Be careful of arthritis if you feel these symptoms. Arthritis is an infection of the joints that can affect single or multiple joints. There are many different types of arthritis with different causes, symptoms and treatment methods. Arthritis is most commonly seen in people over the age of 60, but it can also develop in teens, children, and youngsters. Arthritis is more common in women than men, and it is mostly in people who are overweight. The symptoms of arthritis normally develop over time, but they may also appear suddenly. Here are some symptoms that are commonly seen in arthritis patients. Joint pain. Joint pain from arthritis is caused by the inflammation present in a joint when the disease is active. Joint pain can also occur when the disease is inactive or controlled if the joint has been damaged by arthritis in the past. Active arthritis causes the joint to swell because of both thickening of the joint lining tissue and because of excess joint fluid. Joint tenderness. Arthritis typically leads to the tenderness of involved joints. This is because the inflamed joint lining tissue has aggravated the nerves in the joint capsule. When the irritated joint capsule is condensed by external pressure, such as from touching the joint, it is normally tender. The pain elicited from compression is immediate. This is one of the reasons that arthritis can lead to difficulty sleeping. Joint swelling. Swollen joints are very common in arthritis. Sometimes the joint swelling is minimal and can be difficult to realize. Other times the joint swelling is very apparent. Normally, people who are affected by rheumatoid arthritis can easily tell when their joints are swollen. The joint swelling can direct to loss of range of movement of the joint. Joint swelling in the fingers can make it tough to get rings off and on easily. Joint redness. Redness occurs over joints when they are inflamed. The redness in the skin over an inflamed joint from arthritis occurs because the capillaries of that skin are widened by the adjacent inflammation. Joint redness does not occur in all inflamed joints from arthritis. Occasionally, the inflammation in the joint is not enough to cause the capillaries in the skin to dilate. Loss of joint range of motion. As the joints of arthritis become more inflamed with active disease, they tend to have an incomplete range of motion. The range of motion is restricted by the swelling inside the joint. This is typically associated with weakness in the affected areas. Joints affected by long-standing arthritis commonly lose range of motion permanently. Don't forget to like and subscribe to our YouTube channel for more related videos.